Katie, Kassin, welcome to the Vermillion Unplugged. How are you doing today?
I'm great, thanks. And thanks for having me.
Sweet. I'm so excited because we were just talking about a little bit right before this that a lot of people recommended you, and also had your husband on. But before we get into it, so what do you do?
Several things. So first and foremost, I'm a mom, but I'm also a physician assistant. I worked clinically for 10 years, and in 2019, I started teaching at the USDPA program. So I still work every once in a while in acute care down at Sanford Vermillion, typically one day a week.
If I remember right, it's not like a full-time doctor, like an MD.
Correct.
But were you a nurse before that?
Nope. So with the PA track, you do not need to be a nurse prior to. And actually, when I look back at my last 5 cohorts that we've had people from all walks of life. So we've had pharmacists before, we've had people come straight from undergrad. In order to get into the PA program, though, you need to have some sort of patient experience. So before I was a PA, I was a pharmacy tech.
Oh, okay.
Yeah.
What made you want to transition to a PA?
You know, I was really interested in being a pharmacist, but what I found while I was working was my position as a pharmacy tech, I actually got to do more of the handling of the medications than the pharmacist did. They were on the phone all the time with insurance companies and providers' offices. And so I really enjoyed the one-on-one patient care. Really didn't want to be a physician. You know, it's just something I wasn't wanting to commit to, but I had a PA growing up in my small rural town, and they really kind of inspired me to pursue that myself.
So what's the main difference between an MD and someone that's a PA? I remember the first time I saw like the PA, I think if I took my daughter to the doctor and it said PA, and I was like, is it supposed to say MD or DO?
Yeah.
And I was Googling it, and this was like a few years ago. And I saw the physician assistant, and I was like, physician, that means they're a doctor, but they don't have the MD, but they're still qualified. And then I did a little bit of the research stuff, and I saw how, like, I think here they got a PA program, right?
Yep.
Yeah, and I saw the requirements or everything that you got to go through. I'm like, oh, snap, you could do that without going through the 4 years of this and then another 4 years of med school and then this and this.
Yeah.
But what are those, like, main differences?
Well, obviously, as you kind of just alluded to, the schooling, the length of time that you spend in schooling, with being a PA, it kind of depends on the state in which you practice. But as a physician assistant, and as you kind of mentioned before, when you took your child down, you know, I can see my own patients. I can prescribe medications. I only work acute care, so I'm not going to go do any procedures, but I could be a surgery PA. I could work in dermatology. For 10 years before I went into academia, I worked in urology. And so I worked one-on-one with the physicians that I was with. But a lot of times I would do outreach clinics in small towns in Nebraska and Iowa. And sometimes I was by myself too. So definitely there's a huge difference in the amount of schooling, right? But we are taught under the physician care model. So we're really following a lot of that, just not quite as in depth.
Is there, what's that word? What do I want to say? Well, no, let me go back to it. How was the schooling, or how long is it?
Yeah.
How was your experience like?
Well, again, it kind of depends on the program that you go to. When I was in school in the PA program, just a couple many years ago, it was a 28-month program. They have since transitioned to 24-month programs. So the first year is your didactic phase. So you're here in class. So 12 months in class with myself and 2 of the other main didactic providers. And then the second year is when they go into their clinicals. And so they will go out into different rural areas, mostly in South Dakota. I shouldn't say all rural, different areas in South Dakota. We send a lot of people, of course, to Sioux Falls. But they will do a 6-week clinical in different things. So it might be rural medicine, it might be internal medicine, emergency medicine, pediatrics, women's health and obstetrics. And then they can also, I'm missing one in there, I can't think of off the top of my head. Oh, surgery, they have that too. But then they get to choose a couple electives. And those are shorter, about 4 weeks, but you can really choose anything that you're interested in, whether it be, orthopedics or cardiology or dermatology. People choose a lot of different things for those.
And there's a big demand for PAs, right?
There is, yeah. One of the great things about being a PA is there's lateral mobility. So, when you go to school, you don't have to say, gosh, I think I want to be a pediatrician, right? You can say, I think I'd like to start out in pediatrics. I wanted to start out, in ortho, but I found myself a urology job. And when I first did that, I thought, I'll put a good year into this and we'll see. Urology didn't sound that exciting, but 10 years later, I was still there. So,
oh, snap. So it's kind of like a little flexible.
Definitely flexibility. Mm-hmm.
For PA, the one that I just, you just told me there's like a bunch of different ones. I thought it was just one. The same thing. I thought like doctors only had one thing. But so do you know like the main, is there a big difference between, let's say like the PA, like at the hospital we go to versus just like a family doctor? Or they like have the same basic knowledge?
Yeah, so we're kind of all taught under that physician care model. Nurse practitioners kind of fall in with us as well. So nurse practitioners and physician assistants are oftentimes referred to as advanced practice providers. And so NPs actually have a little bit of a different model that they practice under, and they usually come from a nursing background. But to answer your question, again, depending on what state you're in, a PA or an NP could act as your primary care provider. And here in South Dakota, especially being a really rural state, we do have a lot of PAs who do act as primary care providers for many individuals.
Then what advice would you give for like a student that wants to either be, they're undecided. They're like, hey, maybe I want to be a doctor. Or should I be a PA? Or should I be a nurse? Or what advice would you give?
I think the biggest thing that you can do to benefit you is to shadow, just reach out to those different respective programs and see if there's shadowing possibilities. Reach out to providers that reach out to either your Sanford or Avera or Monument Health or wherever they may be, and see if there's any opportunities, even to shadow them for 4 hours or so. Sometimes people will really kind of get that experience where they're like, oh gosh, I just don't think I'd really enjoy this, versus they find something, whether that be PA or not, where they're like, oh, I can really see myself doing this.
Okay. Is there a big difference on price for like school? Because I know med school is like it is really, really expensive.
Yeah. Well, in-state for South Dakota residents sure looks good. So for those in-state undergrad or not even undergrad individuals who have graduated before, who are interested, in doing something like PA, yeah, it's going to be significantly cheaper than med school just because of the number of years that are involved. Again, for a PA program, you're going to have your undergrad degree, and then you'll also have your 2 years of the PA program versus, as you mentioned before, with med school, 4 years, and then going on to your residency and potentially even fellowship.
Man, I should have been a PA.
Hey, there's still time.
Don't tempt me.
Yeah.
I didn't know that, because I always thought like to be like in the healthcare field, you had to be like a medical doctor. And then when I graduated in 2020, I found out, for some reason, I don't do my research. I found out about nursing, but I always had the stereotypical thing about like a nurse, like in the old school movies.
Oh, sure.
I didn't know they did a lot of stuff. I was like, hey, it's kind of interesting. And then we got here, when I saw about the PA, I was like, oh, so you could kind of, also help patients like that. I'm like, whoa, there's a lot of options.
Yeah.
Then I checked the prices for like med school, just see how they are. I'm like, whoa, that is really expensive.
Yeah, definitely expensive. There's still a lot of competition for PA schools too. Sometimes, again, it depends on your location in the country and the schools. Sometimes PA school is actually more competitive to get into than med school, just because there's a lot of individuals who are seeing the benefit of being a PA versus a physician. And what I say with that is, or what I mean with that, is maybe more of that flexibility, more of the opportunity to provide one-on-one care, and not quite as much of the liability is not the right word, but with physicians needing to supervise in some states, and if PAs are under a supervising position, depending on what state you're in, some of that liability might go back to the supervising physician.
Okay. I'm gonna tell my daughter to be a PA now. I told her. That's kind of cool.
Yep. Though, let me give a shout out to those nurses. Without those nurses, man, we wouldn't have the opportunity to do a lot of things we do. They're great. So yes, nursing's great too.
So you guys do know Sydney Davis?
Yeah.
So she's a nurse, but she's a
nurse anesthetist.
Okay.
It's a mouthful.
Okay, and I couldn't get that word right. Okay. See, I didn't know there's different branches of different things.
Yep. She gets to put people to sleep for a living.
That's funny. So diving back into your career, so what was one of those first jobs you had?
My very first job out of school was in urology. And so I worked down in Dakota Dunes, saw my patients. Usually I was working with a physician, but there was a lot of times that I was going to outreach clinics by myself. And then one of the physicians thought, you know what, I think you can do some procedures. We're going to have you do some procedures. And so he trained me one-on-one for a procedure called a cystoscopy, which is a look inside your bladder with a little lighted telescope. And we're looking for different things like bladder cancers and stones, lots of different things. But we trained for quite a while. And when he felt that it was okay for me to start doing these on my own, I was doing them on my own. So that was pretty cool too. I really, really enjoyed urology. In fact, I teach it here at USD in the PA program, and I still get all giddy when I'm talking about it. And then when I have students who say, hey, I'm thinking about urology, I'm like, oh yeah, I hope you love it as much as I do. So yeah.
What gets you so passionate about urology though?
I think when I went into urology, it was only myself and one other female PA. There were no other female providers. And most of the time, urology, it's a pretty male dominant subspecialty, or specialty, I should say. And so I was seeing a lot of females who were struggling with female issues, whether that be like a prolapse or an incontinence. And, you can really build rapport with somebody when they feel comfortable with you, right? And so a lot of females feel more comfortable with females for those types of issues. And so I really had a huge following of patients that I really just developed great rapport with and enjoyed taking care of them. And that doesn't mean I didn't take care of the male population as well. Certainly had my fair share of male issues that we had to take care of too. And I just really became passionate about all of it.
Okay. With males and females, like in urology, or with the patients, my bad, is there I don't know none about this stuff. But is there a big difference on how the system works with males and females?
I mean, it kind of depends on what you're talking about, right? So bladder cancer is bladder cancer, whether it's male or female. But one thing that affects females specifically would be like a pelvic organ prolapse. So they have kind of internal organs that are prolapsing a little bit. Males don't really have that. When it comes to kidney stuff, kidney stones, kidney cancers, things like that, it doesn't really matter if it's male or female. They affect the same way.
What about UTIs?
Yeah, usually more females than males, but males can certainly get them as well. But yeah, so now when I work at acute care and I have urology stuff come in, I get real excited.
Really?
I'm like, I can take care of this. Yay!
Wow, that's kind of cool. That's fascinating.
Yeah.
So any tips on how to make sure your system is really good, healthy, clean? Is there stuff that we should, because you're qualified, what health advice would you give?
Well, of course, if you smoke, you should stop, right? That's the number one cause of bladder cancer, and it causes a lot of other cancers too. Specifically to urology, drink lots of water. But that really goes for anything. You want good, healthy skin, drink more water. So I am not good at doing this myself, but exercise is important. So yeah, and then, just make healthy decisions. What are you putting in your body? Are you eating McDonald's 5 days a week, or is it, you're eating fruits and vegetables and maybe McDonald's once a week? So things in moderation too.
What do you think about those, like, you've heard of those detoxes or cleanses and all
Yeah.
that? Does that stuff work, or?
I don't know that I can really give you a great comment on that. I think to some degree, they can be beneficial, certainly, in getting rid of some toxins and whatnot. I think if you're somebody who does them over and over and over, that can be dangerous, especially if you're limiting other healthy things going into your body.
Okay.
Yeah.
Now, being a PA, because it looks fun. I kind of wish I did that.
There's its days.
And that's what I wanted to ask. Is there what are like the cons? Like, some stuff people don't know about it. I'm guessing paperwork.
Yeah. So actually, I was just doing a survey earlier today, and it was like, what is one thing that could make your job better? And I was like, use AI. So there are some apps out there where you can take your cell phone into the room and you can turn on an AI app, and it will listen to your conversation with the patient, and then it will create the note for you. Otherwise, you might literally be sitting there dictating into your phone or another device. Or in my case, I typically just type stuff out because I do acute care. I don't have big, long notes usually. But documentation can be draining, very, very draining.
Okay. See, now when you talk about the AI stuff, I get giddy about that. I like that stuff.
It's pretty impressive.
Have you seen some of the AI stuff where they do like videos and all that now?
I've seen a little bit. I have not done a ton. I've done a few workshops just for my job and, learning how I know people are going to be using this. Like, how can I either use that to our advantage or say, no, we need to put some regulations on this. But really what I've only messed with so far is things in Canva, as well as like your Chat GPT. Like, I sound dumb when I write this. Please make it sound better.
Yeah. You don't think, what do you guys think about like the students using it? I'm guessing the AI is not going to replace it's not going to replace y'all's jobs, right?
No.
You need that human,
right. I mean, I think it could do a lot of good things. Like for an EKG, for instance, right now, those EKG machines that, are utilized in clinic rooms just to quickly get a strip reading on somebody's heart rhythm, those really actually already use AI, and they can kind of, within reason, tell you what's going on. So they can read normal sinus rhythm, or they can say, nope, this is too fast, or, oh, it looks like you have atrial fibrillation. It doesn't say it in quite full sentences, but it does already use AI to do some of that. But is it going to replace your typical provider or even professor? I don't see it. Some other things like, I'm trying to think of some, like stores, not your physical stores, but like your Etsy shops and Amazon and things like that. I can really see that being something where it might actually replace some of those things in the future. So,
what about in the medical field? Do you think not replace, but like what are some tools you think it could help with?
Oh gosh, I think honestly, documentation burnout is such an issue, right? I mean, after COVID, it was a huge issue. Even before COVID, it's been an issue too. Provider burnout. The medical field it can be hard, and there's a lot of regulations, and you're expected to see a lot of people and to also provide good service, and you only have so many hours in the day. And if you really can just change all of that time spent doing your documentation and use AI, I think that would hugely help the amount of burnout that we see with providers.
Speaking of COVID, were you in the around the hospitals and everything during that time?
So when COVID first kind of became a thing in our part of the universe, we didn't really know what it was, right? And so I started out working in acute care a little bit, just kind of my 1 day a week. But I have a little girl with cystic fibrosis, which is a genetic lung disease, and that can be deadly. And so I definitely got scared by COVID and just said, I'm not going to risk taking home something to her. So I stopped working acute care for probably it was probably about a year, I suppose. And then got back into it when more and more things were coming out, studies were coming out, and looking at the population of individuals with cystic fibrosis who had gotten COVID and what their outcomes had been. And those were actually favorable.
And then that's another thing I want to talk about, because I remember Chris talking about it, and when I looked it up, and also like people would tell me, also Brenda again, about y'all's daughter has cystic fibrosis. What, if you could explain, what is cystic fibrosis?
Yeah, so it's an autosomal recessive genetic condition. So essentially, you have to have two of the recessive genes, one from each parent, in order to get this. So even though it's genetic, a lot of times because it's an autosomal recessive manifestation, you won't actually see it in other family members. So it's just kind of carried down in a silent fashion. So Chris has this abnormal gene. I have this abnormal gene. Those two abnormal genes together cause cystic fibrosis. If one of us had we do. We both have one normal and one abnormal gene. So if our daughter Collins had one normal and one abnormal gene, she would simply be a carrier for cystic fibrosis like we are. And my son Kellen is a carrier too. But again, genetic condition, it mostly affects the lungs and the digestive system. It can also affect some other things like reproductive organs. In the remote past, like 1950s, it was a disease where children who had this typically did not survive past preschool, kindergarten ages. And so it's a scary diagnosis. We've come a really, really long ways, even in the past 10 years. When Collins was born, there were no medicines out that treated the underlying cause of cystic fibrosis, and now we have 4, and they really have been life-changing. But essentially, the condition itself causes a thick and sticky mucus within the body. And so if somebody were to get a lung infection, typically, if you don't have CF, you're able to cough that up and get rid of those pathogens and all that. But with somebody who has cystic fibrosis, they just kind of harbor that infection. And then that causes lung damage. And over time, the lung damage leads to lung failure. So the number one cause of the number one cause of death of individuals with cystic fibrosis is lung failure. So in the past, you would see people with lung transplants who are very end organ or end stage disease with CF.
What do those new medicines do? Does it help?
Oh, they're amazing. They're so cool. And they're cool on different levels. The one that Collins is on right now, which is the newest and really considered the best, is called Trikafta. And it covers about 90% of individuals with cystic fibrosis. So there's all sorts of different mutations. There's over 2,000 mutations that cause CF. And this one will cover a really good chunk of those individuals. But essentially, it's just fixing that genetic code to the sense, or to the point that it actually makes that gene a little more sensible. Yeah. I could explain it if I had a whiteboard, but I don't. But if you think about like your genes inside your body, right? You think about the CFTR gene is the gene that codes or that would cause somebody to have cystic fibrosis. And so this specific gene causes your salt and water balance or salt chloride balance to be off a little bit. And so with the different mutations, there can be different levels of how severe or how serious CF is and how much it can affect people. But essentially, it can kind of change things based upon that severity and cause a more functional protein channel for individuals. It's very complicated.
Okay. But overall, besides the mucus, like there's no other like effects or abnormalities or nothing like that?
No, looking at her, you would have absolutely no idea that she has CF. She does have to take enzymes, so those little capsules that help her absorb her nutrients and digest her food. If she didn't take those, she wouldn't gain weight. So again, way back in the 1950s, these little kids with CF had chronic lung infections, and they were skinny little mini things. They just didn't gain weight. And so failure to thrive was another thing. But between the enzymes and between these medicines that she uses, and then she also does some breathing treatments to help break up that mucus within her lungs. She really leads a pretty healthy life. She's only been in the hospital once when she was just a baby.
Okay, that's good.
Yeah.
But is there, since you guys are really involved in this, what do you think is going to happen in the future with like the medicines? Would it probably just cure everything or?
Yeah. So, there's a lot of research being done already on how to go in and edit a gene. And they've successfully done that with other things, with some thalassemias, with sickle cell anemia. And I can't tell you all the specifics as far as, is it an infusion or what is it? But literally these individuals are being essentially cured of these genetic conditions. They fully expect that they'll be able to do that with cystic fibrosis as well. Sickle cell anemia and thalassemia are both blood disorders, so they're a little bit easier to address. Whereas CF, we're getting more down into, like your lungs and your pancreas, so it's a little more difficult, I should say, to try to get specifically into those organs. But one of the physicians, a pulmonologist up at Sanford Children's, he has said before, and he's probably, I don't want to overage him, but I'm guessing he's mid to late 50s. He said he fully anticipates a cure for CF before he retires. Now, maybe he's planning on retiring when he's 100. I don't know. But I mean, that's cool to hear somebody who's been practicing medicine, specifically this, for a very long time, to hear them say that. So yeah, I sure hope so.
Okay. I've heard about cystic fibrosis, but I never knew what it does. I worked in a lab. Do you know XJ Wong?
I know the name. He serves on a committee with me.
Okay. I was working in his lab, and then we do a bunch of mice experiments. And I remember one of the things he said was when we take out the organs, something with the lungs.
Okay.
And I don't know if we would dry it out or something, but we would weigh it before and after, and then he would say we're checking the moisture to see if these mice had cystic fibrosis.
Oh.
And that's why I was like, cystic fibrosis. I've heard of that.
How about that?
Yeah, I don't know if they did have it, but that's why I was like, oh, okay. But he said something about mucus.
Yeah, that's crazy. Research is incredible. So really cool thing. Okay. So my daughter's name is Collins. Okay. So I got her name from The Blind Side. The sister on The Blind Side is Collins.
Yeah.
Okay. So way back when, I think it was 1979, I believe, it was either 3 or 4 researchers who discovered the CFTR gene. This one dude's name is Francis Collins. How cool is that?
Oh, snap.
I know. I'm like, oh, it's a God thing. It's so cool.
It just circles around.
Yeah.
Cool.
Yeah. I tried to reach out to him, but I think he's probably a pretty busy dude. I was like, hey, guess what? My daughter's not named after you, but it's so cool just to have that connection. So.
That's so cool. Sweet.
Yeah.
I don't want to get too off track. One of the things with names is, so my mom, her name in Spanish, her name is Maria.
Okay.
And my dad's name is Jose. So in the Bible, like, Joseph and Mary, in Spanish just translates to that.
Oh, yeah.
The only thing is they named me Jose, so I'm a junior, but I was like, what if they name me Jesus?
Oh, yeah.
Like, that'd be kind of weird.
Oh my gosh, that would have been cool. You could always go down to the courthouse and change your name,
Oh, I could.
Yeah.
But it's not the same.
You're right.
All right. Now let's get back into the topic. So I just saw that. So you guys are doing a fundraiser, right?
Yes. Yep.
Can you explain what everything that is?
So I mentioned before, I don't like exercise, right? And usually when people do fundraisers for things, they do 5Ks. And so the Cystic Fibrosis Foundation every year does a fundraiser, and the money that they raise typically is then used for research for new medicines, new therapies, and that continued search for the cure. And so they all have all these different events. It's called Great Strides, and you go out and you do, I think it's a 5K. I don't know. Most people walk it, whatever. So I did that for 2 years, and I'm like, okay, this is the first weekend in June. It is hot. There's all these people out here. Why don't we do something else? What do I like to do? What would be fun? And I'm like, I love throwing parties. And I'm like, you know what? What is better to raise awareness and to raise money than a party? So when Collins was 3, we started doing a little backyard fundraiser. We'd have a bouncy house and some other, just little fun things. And it's really a celebration of Collins and, how well she's doing and stuff like that. But it's also awareness for cystic fibrosis and then fundraising for the Cystic Fibrosis Foundation. So over time, that warped into a gigantic party that I no longer could have at my house. But now it's at the Armory. This year, it's Saturday, September 14th. Sorry, 1/4, coming up very soon. And the past couple years, I've done several things together. So main focus is Collins and doing what she wants to do. So every year we pick a theme. Mm-hmm. This year we're doing karaoke and a dance party. And I was like, I've always wanted to do a glow party. So we got a whole bunch of like neon stuff and black lights. And so this is going to be in the little, words are hard sometimes.
The Armory?
It's in the Armory, but it's in like the little classroom of the Armory. So there's a little classroom in the Armory. That's where all the little kid stuff is going to be.
Okay.
And the main part of the Armory then is going to be a vendor fair. And so we have different vendors coming. We'll have a bake sale. So myself and other friends and community members will donate some baked goods and we'll sell those, and proceeds go to the Cystic Fibrosis Foundation. And then also a silent auction, and that's usually our biggest fundraiser. So I've asked for donations from many different businesses around this area, but also out in like the Black Hills. I have a couple of Black Hills packages and some other really cool stuff. And so that is from 12 to 4 on Saturday, September 14th at the Armory.
Okay.
It's fun. It's a lot of work and it's a lot of fun.
That sounds like a lot more fun than the 5K.
Yeah, right? I don't know why people want to do those things.
See, I can't. Like the 5K, we did my daughter last year. She's on that, what do you call it, Girls on the Run.
Oh, yeah. I just got an email about that the other day.
Yeah, me too.
I was like, no, I'm not running.
We did that and we ran that 5K. Oh, okay, my bad. I tried to run it. I almost passed out.
Yeah.
I was admit running's kind of hard.
Yeah.
Because I like lifting weights, and then if I do cardio, I like being on my bike.
Oh yeah,
the bike is fun. And then over the summer, I was like, well, let me try running. And then I thought I could do it. That first day, I'm running where the high school is and somewhere else, and then I'm like, okay, how much did I do? And I checked. I was like, I only did 8 minutes. And I was like, man, this is impossible.
You made it 7 minutes longer than I would have.
Well, those are tough. And then we have a few friends or a few people that we know, especially at church, they run, but they run like one of them, she said, I think her longest one was like 6 or 8 hours running. Oh. And then there's another guy, his name is Randy. And you'll probably see him. I see him like in the winter, in the snow. And he's like, I don't want to overage him, but I think he's like in his 60s. He's like a professional like marathon runner, triathlon guy, and that.
Oh my gosh.
One time he said that after, I don't know how long he ran, after the race he had a heart attack. But now he keeps going. I'm like, oh snap.
See, even people who exercise all the time still have heart attacks.
Yeah, but I like the party idea. That's a fun one.
Yeah, me too.
A really fun one.
Yeah, it's good stuff. We've done all sorts of different things. We did a carnival one year. We did outdoor like water things, bouncy houses. Yeah, it's been fun.
Okay.
So yeah,
that's some good ideas.
Bring your kids. How old are your kids?
She is 9.
Oh, she'd love it. Yeah, it'd be fun. Okay. Karaoke. Get some Taylor Swift going.
Oh, she started. I remember. I don't know about now, but I remember last year she was really into the Taylor Swift. I guess everyone.
I think so.
Because I remember when I was in high school, Taylor Swift came out. She was doing like country, and then I never paid attention, and I heard about the tickets like being super expensive and this and that, and I was like, what's going on? And then my daughter was singing some Taylor Swift songs. Like, how do you know Taylor Swift? Apparently, she's very popular.
Yeah.
And then we were talking about, you said about their
the podcast
with them,
Travis and Jason. Yeah.
So let's get back to it. Yeah. So another thing. So what got you into working at USD?
Well, I was doing a lot of outreach at that time and traveling all over the state of Nebraska, and I had little kids at home. And Chris, my husband, I think he was working for USD still at that time. Might have been at Mount Marty. But anyway, he was having to do more traveling. And so I was like, I really need to be, closer to home. So I've always thought about teaching. I didn't really know how that would, or what that would look like. I had done guest lectures for a few years. And so I looked, and lo and behold, there was an opening. So that's what got me going. And now I love it. 5 years in, it's great.
Sweet. What are the also cons of teaching?
Sometimes I feel like I'm babysitting.
Really?
I mean, not always. Usually it's really great. But, there's just sometimes where I'm like, no, I'm not going to tell you what's on the test.
They do
know?
Yes.
Oh, man, no, sorry.
Do you ever get some students that are like failing, and then they go to your office and they're like, hey, what can I do? Extra credit, this and that, or that never happens?
So extra credit is not really a thing. I mean, you need to learn the stuff, right? You can't take care of patients unless you know how to take care of them. And so, yeah, you're certainly going to see people who will struggle, and we do our best to get them through. But ultimately, it comes down to, learning and being able to show that you know what you're doing.
But you're not trying to fail people,
not trying to fail anyone. Nope.
Okay.
Nope. I'm not trying to. That's not my goal. My goal is to produce, great providers who are going to stick around the state of South Dakota and provide excellent care to patients. Now, with that being said, if there's somebody who's a risk, we're certainly going to speak up about that too. But yeah, hopefully our interviewing process will weed those out.
Do you also get the summer off?
No.
Oh, you don't?
No, summer's actually my biggest and heaviest teaching load. So yeah, I go hard in the summer.
Oh, because you said the program's 24 months?
It's 12 months. Yep. So the students will get, before they go into their clinicals, they get 3 to 4 weeks off. But usually when they're off, we are prepping for the new group coming in. And usually the new group has already come in. And then we have the group that's about to graduate. So we have a lot of overlap in there in the summer too.
Oh, no.
Yeah, it's kind of wild. Crazy.
Oh, see, that's another misconception. I thought every professor got like the summer off.
I did too when I took the job. No, I'm teasing. I did it. But no, I was like, what? I gotta work? I'm going to work hard in the summer? Man.
See,
that's all right.
Because some of the professors that I interviewed, I'm like, how's your summer? And they're like, no, that's same thing. Like a lot of them, they do research from here over there.
Yeah.
And they're more busy. I'm like, I thought you get the summers off. I know.
Nope.
My neighbor, she works in the dental hygiene.
Oh, sure. Yeah.
Yeah. So I think she gets the summers off.
Yep. Most of them, I think, are 9-month contract.
Maybe I should be a dentist then.
Might be a good idea. I don't know. Well, this would be dental hygiene. This would be dentist, but I don't know. I don't know if the dental schools are like that too. I don't know. And actually, some PA schools will have a break in the summer. It just kind of depends on how long their program is.
So USD or here so they got a med school, PA.
Yep.
They also have the PT, right?
Yep. And OT.
OT is
occupational therapy.
Okay. Yeah. I remember friends saying that. Is there anything else that you guys
have? School of Health Sciences is made up of 9 different programs. Yep. 9. I just listed them out earlier today. I don't know if I could do all of them. All right. So we have those. So med school is not included. So it's PA, PT, OT, dental hygiene, social work, addiction studies. Oh, I'm only at 6. Oh, man. Public health. Have I done that one yet? Health sciences. Who am I missing? They're going to be so mad at me. Oh, no. I can't think of it.
Because health sciences is the 3rd floor. Is it everything?
It's everything.
It's everything?
In that building. Yep.
Does the research thing count? That BBS or not? Oh, no. You said med school doesn't count.
Yep. Nope. They're their own school. Okay. Well, I got 8 of the 9. I did pretty good.
That's a lot.
Man, that's going to make me crazy.
You're Google
it. I know. I'm like, who is it? I knew I'd do that. I shouldn't even call them out. That's right. Anyway.
All right.
The other one's important too. I just can't think of it.
Sweet. All right. Let's move on because I think we're running out of time. So, well, actually, I think we are. So the last thing I do want to ask is, so Chris is involved in the state, and he's a nice guy. I asked Sydney if she wants to do a second round, and I need to ask Chris. I just got back from Mexico like
fun.
a week ago, 2 weeks ago.
Ah, I'm jealous.
The vacation was amazing. The flight was the worst flight I've ever had in my life. It was horrible. We were supposed to fly, I think it was like August 6th. It was on a Tuesday. Our flight was supposed to leave around 6 or 7 o'clock in the morning. So we go from Sioux Falls to Dallas, and then Dallas we'll head to Mexico.
Sure.
So we wake up at 4, and then we get a notification saying like there's a 2-hour delay. I'm like, okay. Then we get another one, 2-hour delay. 2 hour. Whoa, what's going on? And then I'm like, first of all, we probably missed the connecting flight already. So we head to the airport, and when I go to the airport, because we stay with my family over there in Sioux Falls.
Okay.
I go to the airport, and then I ask, I'm like, hey, we missed our connecting flight. There's a bunch of delays. Do I got to know something? Are we going to be scheduled for tomorrow? What's the plan? And they're like, no, we're going to leave. You guys are going to leave today. I'm like, okay. And I just said, can you book us our flight for tomorrow? They're like, yeah. So they got us another flight for tomorrow morning when we reach Dallas. I'm like, okay, sweet. I swear, we leave the airport. Right when we leave the airport, boom, 2-hour delay. It's just till 9 o'clock. I'm like, what is going on?
Oh, my goodness.
So I'm like, hey, well, let's just grab our stuff and see what happens. And then we get there, and they're like, no, it's going to leave at 9. I'm like, you guys sure? I don't know what's going on. But they said something about maintenance. So it wasn't weather. It was nothing. Just
weird.
Yeah. I'm like, okay. And then we get there. Oh, it does fly. Oh, my bad. It flies at 7.
Ugh.
And then 7 p.m. And we get to Dallas like around 9 something. Man, we're hungry. We haven't ate all day. We get like these $12 vouchers at the airport. Like, what am I going to eat with $12?
Some Skittles.
Yeah, probably. And then we go to, my wife was like, well, let's get to the nearest place. There's like a Popeyes in the airport. We get there. They ran out of food.
Oh, my gosh.
So we had to get their bucket of whatever. So I had to pay it was like $50-something.
Oh, my gosh.
And then the worst thing is, so once we get there, they give us a hotel voucher. We get to the taxi person, and we show them our ticket. They're like, yeah. And they say, hey, do you mind if another guy rides with you? I'm like, okay, that's cool. And a guy comes in, and then another lady. They don't know each other. And then I'm from Dallas, Fort Worth, so I know the area.
Okay.
And I check. I'm like, okay, our hotel's like 7 minutes away on south. So we're driving, and it's like 25 minutes. I'm like, where are we going?
Oh, my God.
And I look outside, and we're heading to Dallas. I'm like, why are we heading to like Dallas? That's not right. And the first thing that came to my mind, I've seen movies like this. He's gonna murder us. That's how I picture it. I like movies. I watch a lot of scary movies. I'm like, that's how it ends up. But then my wife asked the guys, or the two people. They're like, hey, where's y'all's hotel at? One of them's in. Well, the lady, hers is in Dallas. The other guy is I think in Burleson. It's like the other side of the airport.
Oh, my God.
I'm like, where are we going? So we asked the guy, the taxi driver, and he says, yeah, we're taking her first. I'm like, well, why didn't you tell us that? And also, we're right there. And then he said, oh, no, it's like 10 minutes. You'll be there in 10 minutes. Like, no, we're not. We're like 20 minutes here. Now we got to go another 20 minutes. And then he's trying to make conversation. He's like, hey, at least the good thing is, you're in a new city. I'm like, I've been here. I'm from here. And then right when we get there, she drops her off finally. We get to our hotel, and then like we get to the entrance. The entrance is like caved in. It's broken.
Oh, my gosh.
How do we get inside? But luckily, like, you go to the side and you got a call. I'm like, man, it was bad.
Oh, my God.
And that's not even the end. Like, right in the morning, they got us a taxi. But I'm like, hey, let's get something to eat real quick at the hotel.
Okay.
They don't have that, what do you call it? That free breakfast?
Oh, yeah. Continental.
Yeah, they don't have that. I'm like, well, you got to pay. I'm like, I ain't paying for that. We get to the airport. Finally, they helped us out, gave us some more food vouchers. So that we get to Mexico. Vacation's great. Amazing, amazing 2 weeks. But the worst thing is when we come back. So they lost our luggage.
Oh, no.
I'm like, what is going on? We finally got it. I got the luggage back like a week ago. I'm not.
Oh.
It was American Airlines, if people are wondering. I just never had that happen.
Yeah, that sounds like a black cloud was following you around.
Yeah, it was, man, I don't even know where I was going with that. All right, but let's almost end it. So, but right before I end this, though, is there any shout outs or anything, last words you want to give out?
Oh, gosh. All right. Well, if you want to edit this out, you can, but
no worries.
It's fun. Okay. All right. So my husband, Chris, you had mentioned, was in the legislature. This is a voting year. And so, love my husband dearly, right? But sometimes males, and your wife can maybe attest to this, are like an extra child sometimes, right?
I believe that.
Okay. So my motto then is vote Chris Kassin for house to get him out of my house.
That's fun.
So that's what I'm going with. That's my shout out. You can edit it out if you need to.
I'll do that. No, that was cool. That was cool. Maybe I should run too.
Yes, there you go.
Oh, I do want to ask. So, when he was running and everything, how was it when he was in office? Did it change? Does it change like y'all's work thing or the family thing, or everything's the same?
I mean, it changes in the fact that, he's up in Pierre for 3 months out of the year. And that's usually leave Sunday early afternoon and get home either late Thursday night or Friday night, depending on the session. So certainly some things were changed where, I was doing a lot more of the kid stuff and holding down the fort, so to speak. But it was pretty cool, too, because sometimes the kids and I would go up to Pierre and you kind of get a little bit of a maybe not special treatment. That's probably not the right way to put it. But I mean, I also had a couple other friends, Sydney being one of them, who was up there too. And so my kids are 10 and 8. They get tired and sick of being in the Capitol. I mean, it's fun, but not that fun. So we'd go sit in Sydney's office and hang out, which was great.
So what did they, man, I should have paid more attention. And I asked both of them, but like, what did they mostly do like during those 3 months?
Yeah, I don't know. Teasing. No, I mean, there's a lot of meetings. So Chris was an appropriator, and so they met every single day. So they decided kind of who in the state of South Dakota got the money, right? But they would sit in committee meetings. I'm actually, well, let me go back to that. So they'd sit in committee meetings in the morning. If you were on a committee or a couple committees that didn't meet every day, which most of them don't, then they'd usually be on 2 committees where they meet Monday, Wednesday, Tuesday, Thursday, something like that. And then in the afternoon, they all get together on the floor. They caucus before that, I think always. I'm not sure that it's always or typically. But anyway, then on the floor, they, hear bills and vote on bills. And so I like to tease that they don't do anything, that it's vacation away from their family. They probably do a little bit. Though what I was going to say is I'm on the South Dakota Medical Marijuana Oversight Committee. So one of my friends who was a legislator got me involved with that. And I sit on the committee as a PA, which is another cool perk of being a PA. But I've kind of had a little experience of what they go through. Not the whole 3-month thing, but we go up twice a year to Pierre and go to the Capitol and listen to, both people who are for and against the changes with medical marijuana as far as what has been suggested or put out legislatively.
Isn't it legal in South Dakota?
Medical marijuana is, but there's only about 4 diagnoses.
Oh, medical, but now recreational.
Not recreational.
I
think that's a ballot measure, though, this year.
Oh, okay.
I might be wrong.
No, yeah, you're right. I saw that, and I was like, I thought it was legal. But medical is, recreational
It's not, right.
Oh.
Yeah, so my job is really more about the medical marijuana stuff and the oversight of that. And if there's more things or less things that we need to do, more restrictions that we need to put on, or some that we have to take away, things like that. So,
does it work? Like,
does the process or the medical marijuana?
The marijuana.
I mean, I think for certain things, it certainly does. It kind of depends on the state that you go to. Like North Dakota has, I think, 30 or 40 diagnoses that you can use to treat, whereas South Dakota has only maybe 4 or 5. But I think it certainly is useful in some diagnoses. There's a risk with taking it, though, too, just as there is with many things or anything. So, yeah.
That's interesting.
It is.
Okay, I didn't know that.
Yeah.
What is one of those things that we're going to talk about? I want to talk about marijuana.
Got another hour? Yeah, I don't want to talk about marijuana on here.
I'll just switch it up. So
we have gone a lot of places today. Urology, marijuana.
See, I told you, I do get off track a lot.
That's okay.
But no, I bet I do got to end this before. But we'll do like a second round in the future. Or I should get you and Chris.
Oh, that's not a good idea.
No. Oh, no. But before that, so have you guys met the governor?
Yeah. Well, he has. I mean, I've taken pictures with the family, but
like not like
we've gotten to go into her office before. She treats kids so great.
Mm-hmm.
It's really cool. The kids get to like do all this stuff. It's really fun.
Oh, okay. But
Yeah.
never like, hey, you guys want to come over and like grab something to eat?
Yeah. No, not like that.
Okay. I thought.
Yeah. No, not me anyway.
Okay. I should have I emailed her. I think I
Yeah.
emailed her about it if she wanted to be on.
Do it on podcast?
Yeah.
That'd be
I don't
cool.
know how it works though, because you have to go through, I guess, their marketing.
Oh, I'm
or
sure.
whatever.
Yeah.
So I was like, well, let me just throw it by, see if it worked with our USD president.
Oh, yeah.
So I got one with her in a few weeks. So that was good. That works
Nice.
cool.
So that'll be fun.
All right, but let me end this now. So, but I do want to thank you so much for being on the show.
Well, thank you for having me. This has been really fun.